Hi, everyone. Welcome and thanks for joining us today. I'm Dr. Lise Lafferty. I'm a Senior Research Fellow at the Center for Social Research and Health, and I'll be the chair for today's seminar. I just want to get started off by acknowledging and celebrating the First Nations people on whose traditional lands I am sitting on today. I'm at UNSW Kensington campus. I'm on the Bidjigal lands, and pay my respects to the elders, both past and present, and extend that respect to any other Aboriginal and Torres Strait Islander people who may be attending here today. And today we are delighted to have Professor Deborah Lupton, who will be presenting on Australians' experiences of COVID-19. Deborah is leader of the Vitalities Lab and the UNSW node of the ARC Center of Excellence for Automated Decision Making and Society. She is one of the leading sociologists of the COVID pandemic and has astonishingly published 3 books on the topic, including The COVID Crisis, Social Perspectives, The Face Masks in COVID Times, a Socio-Material Analysis, and COVID Societies, Theorizing the Coronavirus Crisis. So I think she's, well established to be our speaker today on this topic. So before we get started, before I hand over to Deborah, just a few bits of housekeeping. I see that everyone has muted, so thank you for that. So please remain muted during the talk. And then at the end during Q&A, I may, if you've popped a question to the chat or stuck your hand up, I can call on you and then you can unmute and ask your question. And then please note that Zoom, it has an auto captions function that you can turn on by clicking the CC closed captions button towards the right-hand side at the bottom of the screen. And also to note that the seminar is being recorded and uploaded to YouTube. A link will be emailed within the week to all who are registered. So if you've got to duck off or something's happened, or your friend wanted to see it and wasn't able to attend, they can watch it later. But keep in mind that the videos, including the audience Q&A and anything in the chat, may be publicly available on the YouTube and discoverable through the search function. So I will now hand over to you, Deborah.
Thanks, Lise. Great to be here and to talk about something I've been working on now for the past 4 years. And I guess it's funny, when I said I would like to do this talk, I didn't, and we scheduled the time. I didn't even pay attention to the fact that yesterday was the 4th anniversary of the World Health Organization declaring COVID-19 a pandemic. It was of the 11th of March 2020. So it's kind of good timing in that respect, I guess, because we're going through, those of us who are researching COVID have been going through some reflections on the past 4 years in any case, and what's changed over that time. And that's absolutely what I'm going to be focusing on in this talk. So as well as talking about my research project, which is called Australians' Experiences of COVID-19, I'm also going to spend quite a bit of time talking about, I guess, what you could call the recent social history of the pandemic in Australia. Because as well as doing research on COVID, I've also paid a lot of attention over the 4 years thus far of the pandemic to taking photographs of public health signage and just sort of general kind of ways of living and what I call, I guess, COVID life. So I'm going to be showing quite a few photos that will bring us back and to some of the time periods that may seem a bit distant in our memories now. And I guess what I'm really going to be emphasising throughout the talk is just the sheer scale and rate of change over those. I mean, it's only been 4 years that we've had the pandemic in our lives. But the conditions in Australia, and of course the conditions in every country and across the world, have changed really dramatically over those 4 years. So I'm going to spend a bit of time going over those changes, the different phases in the pandemic in Australia, because it's a really important context for the applied research that I've done, which mostly qualitative interviews, but also one survey, quantitative survey, because it really, to understand people's responses at various points in the pandemic, we also have to understand exactly what was going on in the pandemic at that time. So I'm going to start with that background and then talk about the research findings. So these are the research projects I've engaged in over the past 4 years. So today, as I've said, I'm going to be talking about the top 1 Australians' experiences of COVID. And at various points in that project, which has spanned 4 years, I have worked with different people on that, or just sort of by myself. So to begin with, I started working on this project with Sophie Lewis, and more recently, Ella Butler has contributed to some of the analysis of the findings from this project. But there's 3 other projects I've also worked on over this time that I'm not going to talk about today, but I just thought it'd be worthwhile just saying what they were, and if people want to follow up the findings from these projects, they can. So Australians, I guess what I'm just calling Australians' use of digital technologies during the early pandemic years, 2 separate projects with Ash Watson. It's actually that one came out of a discovery project, which I was awarded just before the pandemic, which looked at how people use digital technologies in their home. And we had to sort of suddenly change our research methods because we no longer could go into people's homes and talk to them about digital technologies. So that was sort of a challenging part of that project. But the positive part of that project was that we'd already started it, and we were already talking to people about how they use digital technologies in the home. And once the first lockdown happened, then of course how people use digital technologies became super important, and how they managed to communicate with people and work and learn from home. With Mary-Anne Clark, we did a little project on how people exercised and used online platforms, self-tracking apps, but also set up little gyms or exercise spaces in their homes during lockdowns. With Karen Drysdale, the newer project is Diverse Experiences of Immunity, where we've talked to people from marginalised communities, mostly to do with blood-borne viruses, and also LGBTQI plus communities, and how they not only think about immunity in relation to COVID, but also to other blood-borne or aerosol-borne diseases. And Karen and I are just working at the moment on writing outputs from that project. So that's very much a live project right now. And fourthly, also a live project, self-tracking long COVID, with my colleague from the UK, the University of Surrey, Sadhana Jayadeva. And we are looking at how people with long COVID use self-tracking technologies to basically keep track of their long COVID symptoms and make sense of their symptoms, and also to advocate for themselves with healthcare professionals with the sort of the proof that the data from their healthcare, from their long COVID tracking have generated for them. Again, that's where we're literally almost about to send the first publication to a journal based on that project. So there'll be a few others coming out from that over the next little while. Just going back to the Australians' experience of COVID, which I'm going to talk about today, that also I have heaps of data yet that I have to analyse. So I'm really just going to be talking about, having said that, I have published quite a bit out of it already, but it's still very much alive, an ongoing project in terms of writing publications out of that project. So Lise mentioned those 3 books that I've co-edited, one co-edited with Karen Willis on the COVID-19 crisis, with contributions from people in different parts of the world. Another book that focuses specifically on face mask in COVID times, with my team from the Vitalities Lab, Claire Southerton, Mary-Anne Clark and Ash Watson. We also co-authored that book, talking about different cultural and social dimensions of the face mask as a suddenly very vibrant and controversial object after the advent of the COVID pandemic. At the bottom right, COVID societies theorising the coronavirus crisis. What I try to do in that book is take various social theories and one by one devote a chapter to how you can apply those social theories, whether it's political economy perspective right up, obviously Foucauldian by political approach, to more than human socio-materialities of the pandemic. So that is very much a sort of theoretical analysis. And then that book on the left is the third edition of my book, Risk, which came out last year. And what I did in that book, I put it there because I actually added a whole brand new chapter. I mean, I added content about COVID throughout the book, but I also wrote a brand new chapter which compares the climate crisis and the COVID crisis in terms of how risk theory specifically, and also specifically sort of misinformation and conspiracy theories and the manufacture of dissent, and how vested interests in terms of both the climate crisis and the COVID crisis have really contributed to lack of government action, to economic factors being privileged over people's health. So I spend a lot of time looking at how we can understand those two crises as, in similar ways, actually, because you can actually see what's called the playbook of vested interests, challenging the science, setting up their own think tanks, having their team scientists go out and sort of counter kind of valid science about both the climate crisis and COVID. We can actually see what happened with what has been happening with the climate crisis, anti-science attacks, and a very similar approach has been taken to sort of anti-science attacks in relation to COVID. So that's what I do in that book. So those are really, mostly theoretical accounts. I do mention some of my findings that had come out at that point of this applied research, but that's not what those books actually covered to any great depth. But they were great for contextualising the analysis of this project. So to get back to the context of the Australian experiences of COVID project, I've identified to date 7 phases in Australia's COVID-19 response. So phase 1 is what I call a distant threat. And so we're getting the first cases of this new coronavirus, as yet unnamed at that point, reported in Wuhan, China, and quickly spreading to other countries. That's January, February 2020, very, very early months when all of us were really just hearing about this new virus and this new disease, as yet unnamed, to begin with. And so we were relying to a huge amount really on news reporting at that point of just hearing about what was going on there. But it was represented at that point as something not really affecting Australia to begin with. But then we have phase 2, the national lockdown. So by that point, the WHO had declared COVID as a pandemic. The Australian government acted actually really quickly after that declaration. So about a few days later, or a week later, implemented the first national lockdown. By that time, we'd had the first Australian cases of community transmission. So there were restrictions. The national lockdown, there's only been one national lockdown. So the national lockdown was implemented. There were internal border closures between states and territories. Of course, the international borders were closed as well. And at this point, hand washing and physical distancing were emphasised as ways to protect ourselves against the virus. And the test, track, isolate and quarantine approach was introduced to try and make sure we knew who was infected with the virus and to do something about isolating them once we knew that they were infected. Then we went into what I call phase 3, the COVID zero phase, which was June 2020 to January 21. So this was after the first national lockdown had been loosened, so everyone came out of lockdown around the country. But there was then a prolonged Victorian lockdown to deal with what was called the second wave at that point. And there were also short circuit breaker regional lockdowns over that time due to leakages from hotel quarantine. So there were people who were still allowed to fly in, a small percentage of people were allowed to fly in from overseas, and because the hotel quarantine system didn't work all that fabulously, there were viral escape from hotel quarantine and then spread out into the community from there. At this point, masks were encouraged and an elimination strategy was pursued. And if you think back then, there was talk of COVID donut days, where basically there was zero community cases. So the zero was the donut. And that COVID zero was achieved for long periods of time in many parts of Australia. For example, in the ACT, for more than a year between the coming out of the national lockdown and going into the second lockdown of 21, there was more than a year when there were no community cases at all of COVID. So we did, in many parts of the country, we did have that long time, a year or more in some cases, where there were no community cases of COVID. So COVID zero actually was achieved. Phase 4, what I call vaccine dilemmas. So that spans February 21 to May 21. So by that point, the first COVID vaccines had been developed and approved. So the response turned to vaccinating the population as the way out of the pandemic, but we did have difficulties with supply. With our government didn't do a very good job in accessing the supplies they needed, and it was called the stroll out because it was way too slow compared to some other wealthy countries. There was also a problem at that point that the AstraZeneca vaccine, which was the first one that was available for most people, was associated with a rare vaccine injury or negative response to the vaccine. So there was quite a bit of negative publicity around AstraZeneca then. So many people were feeling quite wary of having the vaccine anyway, just because of that bad publicity. But then we had phase 5, which was the Delta response. So the Delta variant now was affecting Australia compared with the original variant. That was the second major variant. And so when we had the outbreak from quarantine leakages into the community, that provoked some more short circuit breaker regional lockdowns. So often they were only about a few days or a week. But in New South Wales, Victoria and ACT, there were prolonged lockdowns of, in some cases, up to about 2.5 months of lockdown. And this was to buy time for the rapid increase in vaccination levels to be achieved. So the government at that point had obtained enough vaccine, but had to set up infrastructure to roll it out to everyone and persuade everyone to go and get those first 2 doses that they needed, and that was available at the time. And they set roadmaps, and people were told that this is the way out of lockdown. If certain percentages get the first vaccination, then the second vaccination. And people were promised, citizens were promised really that this vaccine, once they had the 2 doses, would really be the end of the pandemic, because everyone would be highly immune to infection and particularly to severe disease or death. What happened then was phase 6, the living with COVID phase, October 21 to December 22. So we got the lockdown restrictions gradually as the roadmaps for vaccines were the targets were hit. We saw in just a matter of a few months very low vaccination levels going to massively high vaccination levels in some areas of Australia for those eligible, which was people aged 16 plus. 98% got the first 2 vaccines, which was a massive difference over just a few months. So it just showed just the high acceptability in the population and willingness to get vaccinated. Further boosters were offered as well into 2022, and rapid tests became available towards the end of 21 and into 22. But what happened was this living with COVID, state governments and the federal government basically thought, right, if we've got a hugely high rate of double dose vaccinations, safe to open up. And so they dropped a lot of mitigations and they relinquished the COVID zero goal, and the focus turned away from case numbers to numbers hospitalised and deaths. Of course, what happened then was that once the states opened up, was that the Omicron virus variant turned up in Australia around almost exactly the same time as mitigations were dropped, and everyone has this sort of sense of complacency. Oh, we're double dosed, we'll be right. Unfortunately, the vaccine that was developed against Delta did not work very well against the Omicron variant, and we had a massive peak, the biggest peak so far in COVID cases at the end over the summer of 21 into 22, and of course related to that, very high hospitalizations and deaths, sadly. Then phase 2, what I'm calling losing visibility, and I've sort of fairly arbitrarily, I suppose, it's a bit hard to pinpoint exactly when this happened, but I'm saying it's happened from January 23 to the present. So what we're seeing now is far less media coverage, far fewer education campaigns, far less testing and case death reporting. In fact, it's very hard to know what's going on now because a lot of these data aren't being collected, let alone reported. We're seeing a big decline in vaccination uptake and mask wearing, and long COVID becoming more of a problem as infections and reinfections continue with few mitigations. So just to go quickly through, take us through just some of the ways that we're told that we should protect ourselves against COVID by the government. It's really interesting. You see this ad on the right-hand side. That was a sort of video ad. Very much the purple markings there shows people spreading COVID through touching the virus, and a problem in the first few months of COVID and COVID prevention was that the aerosol nature of the virus was not really emphasised. It was all about hand washing and social distancing, but not protecting oneself from breathing in the virus. Then there was a big emphasis on vaccination, as I've mentioned. What we're getting now more recently is almost a sort of acceptance that, yes, you'll get COVID, you're COVID positive again, put your feet up and take it easy. And also, at least by the New South Wales Health Department, this notion that you should be kind to people around you who choose to wear a mask rather than everyone should wear a mask. And here's just some photos I took, which just takes us back again to, we had the shortages of various things like loo paper and soaps and hand sanitizing products and tissues and so on. So a lot of us, we did see those empty shelves for a while, problems with supply chains. We had stickers on public transport telling us we could sit on certain places but not others to keep a safe distance, because again, worrying about sort of physical distancing rather than the fact we were sharing the air with others. The COVID Safe app was rolled out, but was proven to be a real data waste of money. The various face mask wearing was eventually encouraged when it was recognised that SARS-CoV-2 is an aerosol-borne virus. All the signage, and most of this signage, some of it is still around, I guess, just sort of wearing away and sort of falling off, or taken off deliberately. But just think about all the signage we used to see that were telling us what we needed to do to protect ourselves and others. There was a point at which we were encouraged to check in using QR codes whenever we went places, so that we could easily be told if we'd been in the same space as someone who tested positive. And of course, testing. So testing clinics was set up pretty quickly. Then by late 21, we were able to have the rapid tests that we could do at home, but then there was a great shortage of them. So you can see from these signs, we do not have any COVID antigen tests left. We do not know when they will be back in stock. So there was a real problem with lack of access, even though governments were telling us we needed for quite a few people to go to work, to fly and so on, needed to do a test. So there was another problem with supply there, and the government sort of mismanaging supply. Then we have, really interesting pop culture also around COVID. So we get the state premiers of the time, none of whom are there now, they've all since left, being treated almost as superstars, a lot of sort of popular culture around these various premiers, and also the chief health officers of each state became sort of very well known, particularly through the daily press conferences the premiers and the chief health officers ran, very well known public figures. Then we had, I find this very intriguing that there's sort of these products that people can buy, some of it very high end, like the Bohemia Crystal virus. Then There were products people could buy to show that they'd been vaccinated, because there was such a big hype around getting those first 2 jabs. It was something that people wanted to boast about, or I guess show on their bodies in some way. There were socks, COVID survivor socks, and we have a whole chapter in our face mask book just about the whole sort of commodity culture around face masks, particularly in the first couple of years, where it was assumed that it would be okay to wear sort of fabric masks. Now we know they're not nowhere near as protective as N95s, but back then there was this massive industry around novelty masks. There were even Christmas decorations. So that big disc on the left is a Christmas decoration to hang on your tree. And what I find really interesting about that is it's got all those sort of features of 21 related to COVID, all there, right there on that Christmas decoration. You could even buy onesies for babies, my first pandemic. Now, I find it hard to think why anyone would want to buy that for a baby, but apparently it was available for sale. And even Christmas cards wishing you a very Merry Christmas from an appropriate social distance and that sort of thing. So it's really interesting to me, because in some ways that these kinds of products seem to me to trivialize the pandemic and make it almost seem like, I don't know, a fun and novel experience. And yet we know just how much suffering has been caused by the pandemic. And which now get to that. So we can see from this graph, this which I took from our World in Data, September 23. Unfortunately, we can't really get proper data anymore to make these kinds of graphs, but you can see there just from the hospital cases per million in Australia, just where we've had the big peaks, big waves of COVID. Compared to a lot of other countries, though, Australia has done really well, particularly in the first 2 years of the pandemic, where we did have long periods of COVID zero and did manage and control the pandemic extremely well compared to very many other countries, especially places like comparable wealthy nations like the United Kingdom, United States and Italy. And just this morning, there was this article in The Lancet that was published that recognised that Australia was among, that global life expectancy fell by 1.6 years between 2019 and 21. But Australia was among 32 countries and territories out of the 204 studied to record an increase in life expectancy in 20 and 21. So question is, how will we compare when we look at our figures, when we get around to where we're able to look at our figures from after 21 to 22 onwards, because that is when we had started having huge case numbers and deaths. Vaccinations have also gone down. So people just aren't going out and getting vaccinated very much anymore. And in terms of the sheer visibility, if you remember, the news media did really well with presenting us with all the data that we needed to know what was going on. So did departments of health, gave us incredible updates daily so we could see what was going on. But I did this check of Factiva and to look at a number of reports mentioning COVID in the Australian news sources indexed by Factiva, and you can see there, and this was actually, despite what the Factiva graph says, it's actually up to the 31st of August, how much visibility has been lost in the Australian news sources indexed by Factiva in terms of mentioning COVID. We just don't hear as much about it now. So here's just some examples of headlines from January 2020, very much about, you know, what's this mystery virus? Then from October 21, we're getting that phase. This was the sort of opening up phase. Let's all live with COVID, talking about freedom, but also talking about the sudden, you know, the effects of Omicron and how it was suddenly had a massive impact on case numbers. Then from 22 to 24, we've had various commentators like the chap up the top saying at the 1st of January 2022, welcome to 2022, the year this pandemic ends. So we've had various news coverage which has very much minimised the continuing impacts of the pandemic over the past 2 years or so. And then we're getting more reports of Australians less concerned about COVID despite rising cases. And the two headlines at the bottom there, 11th of February and the 5th of February 24, so very recently. So we're getting problems with lack of protections of patients in Australian hospitals. Why is hospitals rolling back precautions? Have you been infected with COVID-19 multiple times? And slow but sure, I guess, recognition of the impacts of reinfection on people's health. So to get to the project, Australians' experience with COVID-19. So far there's been 4 stages, one each year of the pandemic so far. So stage 1, 40 interviews, semi-structured interviews conducted either by telephone or online video calling between May and July 2020. So in the middle and towards the end, or sort of just as Australia was coming out of the national lockdown, for each stage, people were recruited, a different set of people were recruited from all around Australia. So I have people's experiences from every state and territory for each stage all around Australia. I was really keen to make sure I included it, because what we've since known is that where people live has had a big impact on their experiences. Also a big range of age groups, and also making sure that it's not only people living in the big cities, also people living in rural areas, regional areas for each of these stages. So second stage, another 40 interviews conducted in September, October 2021. So that was around the time of those states were coming out of that second big lockdown, and the let it rip was about to happen. Stage 3, 40 interviews conducted September 2022. And then stage 4 was a survey of 1,000 survey respondents in September 23. So these are the publications to date from the project, and that is in order of sequence in terms of the stages they refer to. So the 5 articles with Sophie Lewis are from the 2020 interviews. The article with Ella Butler is from the 21 interviews. These 2 articles I published myself on people's attitudes about vaccination was from the 2021 interviews. And then I've published a report. I've only managed to publish just an open access report so far from the survey, because that's relatively recently conducted. And then I've just finished an article, a book chapter for a book on the narratives of COVID, and looking at case studies across the first 3 years of the pandemic, which allows me to compare people's experiences. And what I've done, apart from the survey, which was a quantitative survey, with the interviews, which are all qualitative, I've taken 2 approaches. I've either done a sort of thematic analysis looking at themes across interviews, or done a case study approach. And one thing I really like about the case study approach is you really get that sort of biographical narrative of people's experiences, and you're able to sort of look at the impacts of things like their age, like their previous health, like their family living conditions and their job and so on. So in terms of findings, and again, I'll emphasize that I'm only, such rich data, 40 interviews, like across 3 stages, there's 120 interviews to go through. And those of you who do qualitative research will realize just how much interview data that is to analyze. So I haven't even finished analyzing the 21, let alone the 22 interviews. So that's very much an ongoing analysis. But from what I've done, and from what I've done with some of my collaborators, is that from the 2020 findings, we found the participants fell into 3 roughly equal groups. There were those who found the lockdown and associated restrictions very difficult. There were those who reported feeling barely affected by these conditions. And there were those who found benefits to the slowing down of life during this period. And other researchers have talked about the silver linings of lockdowns. So I guess that could also be a way we could describe that 3rd group. And so what really was evident, and of course what we can get from having such a diverse range of people all around Australia, is looking at the social spatial dimensions of people's experiences. And it was very much the case that which part of Australia people lived in, what state or territory they lived in, made a massive difference to people's experiences, even during the first national lockdown, where everyone was in lockdown, because whether you lived in a city, say, or whether you lived in a rural community, that did make a big difference to people. Whether they were forced to go out into quite crowded public spaces in a city, for example, to go and do their shopping, or to have their regular walks that they're allowed to do, compared to someone who lived out on a property where they hardly saw anyone anyway, right? So that was where it was really obvious that people's living situations made a massive difference to how they experienced that national lockdown. Of course, their age and life stage. So people who were already retired and didn't have to worry about income, and didn't have to worry about adjusting to working from home, or didn't have young children at home who were learning from home, they had a very different experience for the most part. Having said that, if retired older people were living with a pre-existing health condition, they might have been treated for cancer or have a mental health condition, for example, then that would affect their access to healthcare during the lockdown. But on the other side, what we also found was that people who were already living with a mental health condition or a chronic illness before the lockdown often could use the resources that they'd generated to deal with their condition, to even help others, because a lot of people did struggle with the isolation they felt during lockdown. And people who were already living with a mental health condition said that sometimes they could reach out and offer their friends some, obviously they would do it online through video messaging or calls or whatever, but they felt that they could offer some assistance and say, this has worked for me in the past, how about you try this? So they felt like they'd already sort of been, I guess, prepared in some way for this situation of lockdown, the stressful situation of lockdown. There were some examples of people who'd lived with HIV for a very long time and been part of the HIV community and knew very much about how to educate communities about infectious diseases, who felt that they could draw on their knowledge of those community support and information sharing as well. So some people felt like they actually could contribute in really positive ways to their community during lockdown. So in terms of changes across time, so what's also interesting is because there's been such huge changes over these years of the pandemic and in between the periods in between the different stages of my project, and things have changed so much, I've been able to, where I have been able to spend time going over and comparing changes. So the rollout of the vaccines, for example, there were no vaccines around in the 2020 interview stage, but by the 21 interview stage, that was where, at the point at which everyone had been exhorted to go and get the double dose. And what came out there was just how positive people were about the fact there were vaccines. They were so grateful that they could finally get access to them. They just, even if they've had a few misgivings about potential side effects, the people in those interviews were so positive, and they really believed that the vaccines would be the way out of the pandemic. What I found with experiences of testing infection, of course, as particularly in the 2022 interviews, far more people had experience with testing, particularly the rapid tests, which had become available over that year. But far more people had been infected, or their family members had been infected. In the 2020 interviews, no one had been infected or didn't know anyone who'd been infected. But by 2022, people had been infected, and some people were already struggling with the long-term effects, long COVID. Mask recommendations and mandates have changed, of course, since late 2020 into 21, where mask mandates were around, very obvious, and people knew about conforming to them. They were dropped mostly by 2022 in most situations. It's interesting that people in 2022 said that they sometimes didn't feel very safe going out in public because nobody was wearing masks anymore. They were still wearing masks. Some of these people were still wearing masks, but felt like people had dropped the ball and people were no longer protecting each other. And that made them feel quite anxious about going out in public spaces in 2022. So what was a really interesting finding is trusting government and information sources. So not only my research, but quite a bit of other research in Australia showed that Australians really did invest their trust in government and official information sources such as global health authorities, such as the World Health Organization. In 2020, they felt that they were giving them appropriate and accurate information. In 2020, for the most part, very positive about government measures. They felt that the government was keeping them safe. For example, in 2020, even in 2021, when Ella Butler and I published an article about what people thought of the internal border closures. And so many people said, I'm so glad my Premier, a lot of trust and faith in their premiers. I'm so glad my Premier is keeping the border shut between us and the other states because it makes me feel safe. It's protecting me. So that was really interesting to see in terms of socio-spatial dimensions. That gets to effects of location and local government responses. As we know, Western Australia effectively closed their borders to the rest of Australia for 2 years. And people in Western Australia, for them, they said that the COVID, after the first the national lockdown, which they did go through, but after that, they had very few cases for 2 years because their borders were closed to everyone and everything. And they felt that COVID was a dream. It was like living in this protective bubble where COVID was happening elsewhere in Australia, but there was no impacts at all on them in Western Australia. Of course, compare that to what was happening in Victoria and particularly Melbourne, where Melbourne had gone through 3 extended lockdowns by late 2021. And they had, so they compared to people in Western Australia, they had gone through many more restrictions, and they obviously, the materialities of COVID had impacted them in a far greater way. Perception of risk. So in 2020, people did feel initially at risk, they said, but when they saw with the lockdowns and all the protections of lockdowns, they didn't feel very personally at risk because they could see that the lockdown was working, that it was reducing case numbers and that they weren't being exposed to the infection of the virus. But by 2022, it was interesting, there was a sort of difference in 2022 between some people thinking that COVID was still at high risk to them, other people saying, oh no, it's not going to affect me anymore, I'm not going to bother wearing masks or testing anymore. So quite a difference between that group of 40 interviewees in 2022. And ideas about the future. So the final question I asked was, how do you imagine the future of COVID? What do you think will happen with the pandemic into the future? And I haven't managed to do a lot of analysis looking across the 3 sets of interviews yet, but that's going to be one of my next things I want to write. But it's interesting that in 2020, people were quite optimistic and hopeful. They were just coming out of the national lockdown. Things were looking good. The virus looked like it was pretty well controlled at that point. And so people said, I actually would like to see, I would like to see better social justice. I would like to see better provision for people on social security benefits, which did actually happen at that point. And by 2022, though, asking people about how they saw the future, they were, again, quite diverse in their thoughts about the future. Some people were still feeling very cautious about whether they wanted to drop protections, feeling exposed, a bit worried about getting infected again if they were still suffering effects. So interesting too. I haven't been able to spend a lot of time tracing that, but it'll be really interesting to look at that, how people imagine the future. And I'm just going to finish off with some of the key findings from the survey, which was the 2023 stage. So I wanted to do a very quick survey because one reason is I just was noticing over that last year, that that at least in terms of media coverage, as I mentioned, there was a lot less visibility, there was a lot less public health information. I was just wondering, and as a survey is much sort of quicker to get those findings from than conducting interviews and then analysing interviews, I just wanted to do a quick survey just to see what sort of take the temperature, I suppose. So by that point, September 23, more than 2/3, almost 70%, reported having had at least one COVID infection to their knowledge. We know that people can be asymptomatic with SARS-CoV-2, so a lot of people don't know it, but these were people who did know it, that had a test, they either had it. And 1/3 reported one infection, but a further 22% reported two infections and 13% experiencing 3 or more. 40 of those who'd had COVID, 40% said they had experienced long COVID, which is a pretty shocking percentage from 1,000 people, across 1,000 people. And then the 2/3 who had had COVID, 40% of those 2/3 had experienced long COVID. That is a real worry because we know that there is no cure for long COVID and people are really struggling getting any kind of acknowledgement or treatment for long COVID. And if you're wondering, I gave them the WHO definition of long COVID. I actually did say symptoms lasting more than 3 months after the first infection, acute infection. They'd reported a high take-up of the first 3 COVID vaccines, but after 3 doses, the proportion drops considerably. And in terms of asking them, do you plan a future COVID vaccination? Only just over 1/3 said they were planning to get another vaccine in 12 months. And a similar proportion said no, and 27% were unsure. So really loss of interest in getting vaccinated. Face mask wearing as personal practice was low. Only 9% said they always wore a face mask to protect themselves against COVID when inside public places. So that has really, really dropped. The Bureau of Statistics did surveys that showed in 21, for example, that face mask wearing was really high amongst Australians, but this finding shows just how much it's dropped. And I guess we can see with our own eyes when we're in public places that most people aren't wearing them. What's really interesting is support for face mask mandates for healthcare workers while at work was higher, but only 58% in at least partial support. And when you think that that's the patients who are exposed to COVID when they seek healthcare, is not a good situation for that patient, and nor is it a good situation if healthcare workers keep getting it. That is a bit of a worry too, that people don't seem, that at least 42% don't seem to think that's important, that it's mandated. And only a slight majority, 59%, thought COVID was still posing a risk to Australians. So there is seemingly, at least from that, a loss of seeing that COVID is a great risk. And it's also interesting to see the lack of trust in even expert sources such as doctors and experts in the field. I mean, if only 60% of Australians consider doctors to be a trustworthy source of COVID information, that is a real problem. Just shows the undermining of trust in experts. Only just over half trusted Australian government health agencies, a bit under half global health agencies, less than half scientists. I mean, I think that's a real problem, that huge loss of trust in expert sources of information. And they were mixed in their assessments of how well the federal and state territory governments were currently managing COVID. So kind of very similar for both, but quite equivocal. And just a final slide just reflects on some of the socio-economic political contexts, such as, the neoliberalism, withdrawal of the state. We're getting, particularly now in the 5th year of the pandemic, we're getting a lot of social groups left behind. We're getting this invisibility of risk and invisibility of public health protections across the population. We're getting withdrawal of public health controls and over-reliance on pharmaceutical solutions, abandonment of workplace health and safety, and very, very worryingly, healthcare safety failures for patients and staff in healthcare facilities and aged care. And still no real attention paid to how we can clean the air in public buildings such as schools and workplaces. So I will leave it there. Thank you. I'm interested in any comments or questions you might have.
Thank you so much, Deborah. That was just an excellent overview of everything that you've learned, and much of what we all had observed over the past 4 years now. I see there is a question in the chat or a comment from Libby. I am struck by how much of the first year or two I seem to have blocked out. Did you ask about specific long COVID symptoms? If so, what were the most common?
No, I didn't ask about symptoms. I just asked them if they had experienced the symptoms of long COVID. So either in the past or currently. So 15% said they were currently experiencing long COVID, and 25% said that they had had it in the past, but they no longer had the symptoms.
Thank you. If anyone else had any questions, feel free to pop them into the chat or stick your hand up, as Grace has done. Grace, do you want to ask your question? Come off mute.
Hi, thanks. I'm Grace. I'm from the National Ethnic Disability Alliance. I was wondering if there was any trends over time in terms of people who identified as people with disability, chronically ill or disabled that you found?
Because I haven't been able to really spend a lot of time looking at the 21 and 22 interviews, I haven't been able to really focus on looking at changes across time, but it's definitely, as I mentioned with the 2020 interviews, the initial year interviews, it was interesting to see how some people found that the situation improved for them. One thing that people did appreciate was being able to communicate more easily with others online, whereas in previous times they couldn't participate as well in various events because of mobility issues, for example, or other access issues. But that is something I would definitely like to look at and see how that particular group, how their expenses did change across those 3 years. But I haven't been able to really spend a lot of time on that so far.
Thank you. Thanks for that.
And someone else has asked if you asked the cultural background of the people that you interviewed.
Yes, I did. I asked what was their primary language that they spoke at home in the survey. That was the indicator I used there. And in the interviews, they were asked, they were asked how they would define their ethnicity, how they would describe their ethnicity and ethnic ethnicity, heritage, or ancestry. So yeah, I did ask them about that. One thing that did come out in the interview data, at least, and particularly in the first year of the interviews, was that people who came from Chinese ancestry were quite concerned about racism, because as we know, there was quite severe racist statements made about the Chinese virus, particularly by Donald Trump, people like him, right-wing demagogues like him, racist demagogues like him, and a lot of blame in some of the more right-wing media placed on China and Chinese people by extension for the virus and for the spread of the virus. So there were, in terms of ethnicity and people's ethnic backgrounds, that was something that came out amongst some of the people of Chinese background in the 2020 interviews. They were concerned about racism.
Thank you. Michael, you have your hand up. Michael, I can see you've come off mute, but we can't hear you.
Is that better?
There you are.
Okay, that's better. Okay, Deborah, thanks and I even can turn on my video, actually, it might be some use. Thanks so much for that very interesting presentation, but it struck me just how specific the actual implications and consequences of this pandemic have been. So one of the fields that I've been continuing to work in, both as an academic, as an editor, editing papers on the impacts of COVID on caregiving and care receipt internationally. It's seems to have come up continually as having a major impact. And in Australia, both the nursing homes and aged care services delivered in the home, and to a certain extent NDIS, have become much, much, much more affected. So it's virtually impossible for anybody now to get an aged care package delivered at home in most areas, or at least in many, many areas. I know this from personal experience, but also from reports from colleagues. Do you think this will come out in your data, or have I just got one of these very distorted perspectives from focusing on such a very specific perspective?
Well, it would come out if among people who were interviewed who were trying to find care for a family member. None of the people interviewed was in a care facility, so I wouldn't be able to get their perspective from the interviews. But there may be people I can look at who have a family member in care, but I haven't really gone through and sort of identified those people, because it hasn't been sort of one of the things I've been looking for thus far.
Was the sample selection in your 223 survey, was that broad enough to pick up a representative sample, or is it a selected sample? Would that be relevant?
So I commissioned a market research company to recruit the participants to make sure they were representative of the Australian population, and particularly of the populations of all the different states and territories, so, and across the age group, representative age groups. So there wasn't a question in the survey about whether you're in a care facility, so I wouldn't know from the data I have whether people were in one or not. I mean, it was literally tick the box questions, so I have no further information about that. People weren't asked to expand on their answers. So, I mean, that is the problem. I mean, that's the beauty of a fully quantitative survey is, of course, you get the data very quickly once the survey's been completed by 1,000 people. But of course, the beauty of the qualitative approach is that you really can ask people about their lives and their explanations for why. For example, why people don't feel they're at risk anymore from COVID.
Now, well, the beauty of a survey is also its representation, that it does survey a broader sample, and one might expect there would be some nurses. For example, I think that there's quite a lot of people dropped out of the care workforce. I think that there's quite a lot of nursing homes where they still have lockdowns effectively, sometimes only for a week or two, sometimes in only one facility or part of the facility, but that sort of stuff is still going on. And I think it might come out if you go through that with a sort of fine-tooth comb. I'm not quite sure if you'll have
one of the case studies that I did write about in the chapter I mentioned was a Chinese Australian nurse who lived in the family home with her older parents, and she did talk about how she was really, really concerned about passing on the virus to her family, for example. But yeah, I mean, I can absolutely go through and look at the other interview data and see who else is in a healthcare setting. But I mean, there's other people, like Karen Willis has done some really great work focusing specifically on healthcare providers. So it's not like I'm the only person doing research in this area. I think there's other people doing really great targeted work on that in Australia.
I'm just mindful of the time. We're on 4 o'clock now, and Becky's got her hand up. Did you want to ask it? You'll be our last question.
Actually, I'll let Sheila talk because I see that she has been raising her hand a few times.
Oh, I don't see that one. Okay, sorry, Sheila.
I'm
You go
muted.
ahead.
Yeah, I heard, thank you very much for a very interesting trip down memory lane as much as anything. And we certainly identified with being comfortable retirees who developed our computer skills enormously, and we could be grateful to COVID for that. My comment would be, I've met some young mums recently with young babies who were born during COVID. And one of them told me that a lot of the babies missed out on that natural socialization during those lockdown periods, so that now when they're about 3, 4, they don't easily make eye contact with strangers who might smile at them on the train or something like that. I just wondered if there's any validity in their comments.
Well, that's not something I've researched, but if you were in many states of Australia, they only had one extended lockdown for about 10 weeks, that first national lockdown. So they wouldn't, you know, that wasn't actually, I mean, it's different in Melbourne, of course, but babies are still interacting with family members in the home. Maybe and presumably they could have gone out with their parents to the supermarket. We're all allowed to go out shopping. So anyway, I don't really know. It may well be the case, but I'm not a child development expert, so I can't really comment on that.
Thank you.
It's a great question, though, as a parent with a little one who was born during that early era. Everyone, thank you so much for joining us today. Deborah, thank you for such a wonderful, insightful talk and an overview of what we've all been living through for the past 4 years. Really appreciate your knowledge and sharing all of your expertise on this. Just to let everyone know, our next SPRC CSRH seminar will be held on Tuesday, 9 April from 10 to 11 a.m. We have a special time slot as one of our 2 speakers will be joining from the US. Dr. Danielle Russell, a postdoctoral fellow at the Kirby Institute, and Professor Beth Meyerson from University of Arizona will be speaking on the praxis of engagement, observations from the US and Australia. And event information will be circulated in the next week or so. Thanks again to Deborah and for everyone for joining us today. Have a lovely rest of your afternoon.